17.4 million people die each year due to heart disease, according to the World Health Organization, and one-third of this occurs in young people and those less than 70 years old. While we've long been told that unhealthy diet, lack of exercise, smoking, and other lifestyle choices are the causes of heart failure, nobody talks about how drugs taken to improve our health pose a great risk to our hearts. I'm not talking about rare drugs taken seasonally. I'm talking about common over-the-counter medicines we take on a day-to-day basis. Herbal medications are also not excluded. Before I go on to start talking about these drugs, please subscribe to my channel if you haven't yet, and make sure you watch till the end because some medications I'll be talking about will surprise you. The first drug on the list is corticosteroids, or steroids as they are popularly known. Steroids are used in the treatment of a broad range of diseases like asthma, topical dermatitis, Addison's disease, and immunosuppression in transplantation. Examples of steroids include prednisolone, hydrocortisone skin cream, clobetasone, and the likes. They are used in the treatment of these conditions due to their ability to suppress the immune system. But aside from this, they also function in sodium and water retention. Water retention simply means there is an increase in the amount of water in the blood. When there is more water in the blood, the work on the heart increases. The heart is no machine, so if this increased workload lasts for a very long time, which can occur due to prolonged use of corticosteroids, it can make the heart weak and lead to heart failure. The next is anti-cancer medications like anthracyclines. Anthracyclines such as doxorubicin, daunorubicin, epirubicin, and idarubicin are among the leading causes of heart damage. These drugs, when used, lead to production of reactive oxygen species. Reactive oxygen species are like waste products produced by cells during metabolism. They can be toxic to different cells in the body if they accumulate in high enough quantity. These anti-cancer medications increases the quantity of the reactive oxygen species that target the heart muscles, leading to their destruction. Next on my list is antidiabetic medications like thiazolidinediones. Examples of thiazolidinediones are drugs like rosiglitazone and pioglitazone. They increase the reabsorption of fluids from the kidneys and also lead to fat accumulation. Fat accumulation could lead to deposition of fat in the blood vessels, which can lead to atherosclerosis. The fluid retention increases the amount of fluid in the body, which increases the work on the heart. These two mechanisms can work together to lead to damage of the heart in lots of patients, especially those with a background heart problem. NSAIDs like aspirin, ibuprofen, naproxen, diclofenac, and celecoxib, which account for 70 million prescriptions and 30 billion over-the-counter medications sold annually when taken, inhibit prostaglandin synthesis. Prostaglandins are important mediators of inflammation. Inflammation is the process the body uses to heal itself. So, when a tissue is injured in the body, prostaglandin production is increased, and this helps in inflammation and healing of the body tissue. Aside from inhibiting prostaglandin, NSAIDs are also said to trigger heart failure through sodium and water retention. When there is increased water in the body, it leads to volume overload, increasing the work that the heart needs to perform. This increase in the function of the heart might lead to injury to the heart tissue, and since NSAIDs inhibit prostaglandins that helps in inflammation and healing, it means that the injured heart tissue might find it hard to heal properly under the influence of NSAIDs, and this can lead to heart failure in the long term. Amphetamines like methamphetamine are drugs used in the treatment of narcolepsy, ADHD, and depression. Narcolepsy is an overwhelming daytime drowsiness, and ADHD means attention deficit hyperactivity disorder. Methamphetamines are also drugs used in drug abuse. They work by increasing the level of dopamine and norepinephrine in the body, which acts to increase the heart rate and also increase heart contraction. While this might be great in the treatment of some conditions that lead to slowing of the heart, like heart failure, in the long run, it can lead to arrhythmias, which is when the heart starts to pump irregularly. This is why heart disease is the second most common killer of people who use methamphetamines. The last medication I'll be talking about is a herbal medication that a lot of people use. I'm talking about licorice. Licorice is the extract of Glycyrrhiza glabra root and is used as a flavoring in candies and tobacco products. It has also been used historically for the treatment of dyspepsia, which is the pain felt after eating, and upper respiratory tract infections. The active component in licorice is glycyrrhetinic acid. Carbenoxolone is a synthetic derivative of this component and is pharmacologically similar to it in its activity and adverse effects. Carbenoxolone and glycyrrhetinic acid found in licorice inhibit the enzymes that degrade aldosterone and glucocorticoids. This means that these steroids would last longer in the body and their adverse effects would be prolonged and enhanced. Remember we talked about steroids and how they lead to water retention? Well, licorice keeps them in the blood for longer, helping them perform their function better. Licorice ingestion has been associated with heart failure, edema, hypokalemia, which is when there is decreased potassium in the body, polyuria, when there is excess production of urine, polydipsia, when there is excess taste, muscle weakness, and hypertension. It is important to know drugs that can damage the heart to be able to avoid them or take them with caution if you can't avoid them completely. If you've learned anything at all from this video, please subscribe and share so others can benefit from it. Thanks for watching. Bye.